Good morning and welcome to a special Facebook Live on erectile dysfunction and urinary incontinence. I'm Nicole O'Donnell from the marketing department, and today we're here with Dr. Gor, who will be talking to you about men's health.
Hi Nicole, thank you so much. To the viewers, thank you for tuning in. I know it's a busy election day, but appreciate you being here. My name is Dr. Ronak Gor. I am the Director of Genitourinary Reconstruction here at Cooper University Healthcare in Camden, and I'm really excited to have the opportunity to talk to you a little bit about some things that affect men that many men are either embarrassed, don't really want to talk about, or think that it's sort of a normal part of their life. And the things I'm talking about are urinary incontinence, which is the involuntary loss of urine, and erectile dysfunction, which we all are familiar with. Now, you probably are aware that lots of men around you are growing either mustaches or not shaving for this month, and that's because it's Movember or No Shave November, and that's really something that we've been doing over the past decade or so to bring to light things in men's health, typically prostate cancer, testicular cancer, and men's health in general, and to sort of continue from that. A lot of what we don't always talk about, but it's equally as important, are some of these quality of life issues, such as incontinence or erectile dysfunction, which we also will refer to as ED. And as important as cancer therapy is, and as you know, at Cooper, at the MD Anderson Cancer Center, we treat more cancer than anyone in South Jersey. The other half of treating cancer is not just fixing the disease, but is making sure that our patients have good quality of life afterwards.
Good, okay. Well, before we begin, just to let the viewers know, we will be discussing this live in person at an event next week. Dr. Gor, if you'd like to tell us about that.
Exactly. So I'm excited to have the opportunity to share some things with you today, but if you want to have a more interactive conversation where you can ask any questions you want, you can bring your partners. Next Thursday, November 15th at 6:30 p.m. at the Crown Plaza in Cherry Hill, we'll be talking more about this, and we'll put some registration information at the end, but I do encourage you to come if you have more questions.
Great. Okay, so the first question, Dr. Gor, what is erectile dysfunction?
So erectile dysfunction, or ED, is simply the inability to either achieve or maintain an erection that is satisfactory for your sexual health and for you and your partner's satisfaction. How
common is ED?
It's actually very common, and that's a thing that I think many men are unaware of, is that more than 30 to 40 million men are affected by erectile dysfunction. And actually patients are younger than we think. There's a significant percentage of men in their 30s, 40s, and many men over the age of 50 who have some degree of erectile dysfunction.
Okay, should someone who's in their 40s be worried about ED?
That's a good question. It depends on a variety of factors. If you have a known reason for erectile dysfunction, such as you had prostate cancer surgery, then we have a known underlying cause. But if you don't have an obvious cause for having erectile dysfunction, then we do encourage you to come in, because sometimes erectile dysfunction can be a sign of some other systemic problem that you might be having, such as high blood pressure, diabetes, a neurologic issue, and most commonly issues with your heart. So it probably makes sense to you that if you have poor blood flow to the penis for having an erection, there's a chance that you might have poor blood flow in your heart as well. So when we see men who come in and they have erectile dysfunction and no obvious reason for it, I'll always make sure they follow up with a cardiologist to make sure there's no heart issues going on.
Makes sense. Some men think losing erections and their sex life is a normal part of aging. Is that true?
Absolutely not. And this is one of the things that I really am passionate about, is that erectile health and sexual health for you and your partner is not just some quality of life issue that you deal with a few times a week. There's good evidence suggests that if you have an intact sexual life well into your golden years, it helps with things such as high blood pressure, it helps with your cardiovascular health overall, it improves sleep, it improves mood, it helps patients stick to some of their treatment plans for diabetes and other things like that. So we know that maintaining your sexual health is extremely important, and no, it is not normal to not have normal erections as you age, and my job is to help people achieve that.
That's good. So if you do suffer from ED, what are some of the treatment options?
We've been, lucky that over the past few decades there are a slew of options for men. We really tailor your treatment to what your goals are and what you would sort of want out of your sexual life. There are non-invasive options for men. There are a variety of medications that are some now becoming generic and are much more affordable. We can do combination therapy. There are more advanced treatments such as injections and finally surgery.
Can you tell me a little bit more about surgery, me and the audience?
Sure. So, I think most people are unaware that, surgery is available for erectile dysfunction, and the penile prosthesis is a surgical option that has been around actually since the 70s, and each year tens of thousands of men undergo this surgery. You probably know someone around you that has had the surgery. They obviously aren't talking about it, but it's very common. It is a minimally invasive surgery that takes about an hour, and I kid you not, the entire surgery is done through about a 1-inch incision either above or below your penis, and it actually is an inflatable device concealed completely on the inside of your penis that allows you to have an erection for as long as you want, and you simply can hit a deflation button to deflate the device, and then the erection goes away. It's a great option for men who have had prostate cancer surgery, radiation, or simply a motivated man who wants to have intercourse more than a couple times per week.
And Cooper does a fair number of these surgeries right here, correct?
Exactly, yes. So Cooper, as an individual institution, does more penile prosthetic surgery than anyone in South Jersey. And one thing we know about surgeries like penile prosthesis or even cancer surgeries such as robotic prostatectomies or kidney surgery is that you want to go to a surgeon and a center that does a lot of these surgeries, right? Because you sort of do the same thing each time. You have the same nurses taking care of the patients. You have the same team in the operating room. You have the same surgeon. And that's what leads to good outcomes. And thankfully at Cooper, we've had very good outcomes over the past few years.
That's great. And what else do you want your viewers to know about ED?
Well, in general, talk to your doctor. So erectile dysfunction, not something that men want to talk about. But again, it's something that could be a sign that there's something else going on that's significant, and we can actually really help you with your cardiovascular health overall. And a lot of what I've found is that people rationalize the fact that they lose their erections, and partners as they age say, well, we're in our 60s now, and that's not just an important part of my life right now. And what I found is it's not that it's not an important part of your life anymore, it's just that when you lose the ability to do something, sometimes you kind of rationalize that, well, I've had my time and now, it's time for other things. But that's not true. We can really help you get you back to where you need to be. And I see it firsthand every day how life-changing it can be, not just for the patient, but the patient and their partner to have an intact sexual life.
Yeah, that's great. Okay, so we'll just switch gears a little bit now. We're at the halfway mark to urinary incontinence. Can you tell us a little bit about that?
Sure. So incontinence simply just means the involuntary loss of urine. Now, that can happen from a variety of reasons that we'll talk about.
Great. And what are some of the risk factors for incontinence?
Sure. So the most common cause that many men as they age will experience is just a growing prostate. The prostate sort of sits in between the bladder and the urethra, which is the tube that you pee from, and can sometimes constrict the flow of urine, making it difficult to empty your bladder or difficult to store your bladder without having any problems. But other things that can cause it are infections, diabetes, neurologic disease such as MS, and importantly, prostate cancer treatment, whether that's surgery and or radiation.
And how do you evaluate these men for incontinence?
Sure. When a patient comes to see me and us at Cooper, the most important thing is to figure out what type of incontinence or what type of urinary leakage you have, because diagnosing you properly will give you a wide variety of treatment options. So once we get the diagnosis, then we tailor the treatment options for you.
That's great. And what treatment options are available?
So piggybacking from what we just talked about, so depending on the underlying cause, it can be something as simple as doing pelvic floor therapy, or if it's due to other reasons, you can certainly talk about medications that can relax the bladder, relax the prostate. And then finally, if it's from prostate cancer surgery or radiation, there are surgical options for these patients as well.
And what surgical options are available at Cooper?
So for patients who have what we call a stress urinary incontinence, and by stress we don't mean mental stress, but any activity, so moving, leaking when you go from sitting to standing, or when you're at the gym or running and you experience some leaking, that can happen after you have prostate cancer surgery. And there's two options available. One is the male urethral sling, and that is basically a hammock device that supports the urethra, again, which is a tube that you urinate from, and prevents you from leaking. And then for men who have more severe incontinence, so these are men who might be wearing adult briefs or Depends or something like that, we offer something called the artificial urinary sphincter, and that can make the most incontinent man who's wearing 4 or 5 Depends a day be completely dry. And again, both of these surgeries take under an hour and are done in a minimally invasive fashion.
That's great. So what would you like the patients or potential patients to take away from today's talk?
So
sum it up.
Yeah, I really love patients to know that, we're really focused on your quality of life at Cooper. Having cancer is devastating enough, and we often tend to focus on survival and curing disease, and we do that wonderfully here. Thankfully, modern treatment options for prostate cancer have significantly fewer side effects than decades ago, but there are still some men who experience some of these things. The longitudinal care for your cancer at Cooper doesn't end when you have the diagnosis that you're cured of cancer. My job then is to champion the quality of life and get you back to where you need to be. There are wonderful options here, and we'd love to see you for a priority appointment. And so to piggyback off that, we do have a session next Thursday, November 15th, at the Crown Plaza in Cherry Hill at 6:30 p.m. So if you're interested, I encourage you to come, and definitely bring your partner. This is always a shared decision. If you want to register, please go to events.cooperhealth.org.
Great. Well, thank you, Dr. Gor, for taking the time to talk to us about such an important topic. And thank you for tuning in. And that's about it from Cooper Healthcare.
Take care. Thank you.
Thank you.